Hello, my name is Megan Davis, and I'm going to be going over the chickenpox or the Varicella vaccine. That was the vaccine I was assigned. It's a highly contagious. It's a highly contagious disease, and it's very uncomfortable. It's itchy. It can. It's very contagious. Like I said, you touch something, it's usually going to be on the skin of the area you touched after you touched the infected area. This is the disease information I'm going over. It's itchy. It's like a blister rash on the skin. It's very uncomfortable. Chickenpox is also known as a varicella. That's why it's called the varicella vaccine. It's a rare disease now, but when it first originated, it of course was very scary. Your skin has scabs, ulcers, red spots, blisters. You usually know right away if you have the chickenpox. It usually resolves in a couple of days. Nowadays, you don't really see it. About 200,000 cases a year, but it's very contained, a very contained disease now. It's nothing like COVID, but back when it originated, it was probably very scary like COVID is. Now I'm going to go over the vaccine history with you. The reason I can't screen share is because my laptop's too old. This vaccine was developed from an isolated virus. The duration and protection of this vaccine is known to be long-lasting against the varicella disease, chickenpox. Long-lasting immunity studies have showed for this particular vaccine and disease to last 10 to 20 years after you're vaccinated. So when you're an adult, there is a chance the vaccine can wear off, but I couldn't find any cases on it or studies. But I did read about it being very rare, just if your vaccine's not long-lasting towards antibodies. Now I'm going to go over the vaccine type. There's two different vaccines that are licensed in the United States. It's the Varivax and the ProQuad. Varivax is a single antigen varicella vaccine, and ProQuad's for measles, mumps, multiple diseases, and it's a live vaccine. Who should get vaccinated? In my opinion, I think everyone should be vaccinated, but children are recommended to be vaccinated with their first dose at 12 to 15 months and their second dose at 4 to 6 years old. If you did not receive vaccinations as a child and you want to get them, you can get them at any age, but you cannot get them when you're pregnant. But that's the ages. You're very young. It's usually seen in kids, so kids usually can get chickenpox if they're not vaccinated because they haven't reached that age limit yet. Vaccine and booster information. I've learned about boosters through COVID and going to school at UAMS and Newport. It's recommended, but like I said, recommended for your child to get the first dose, 12 to 15 months, and then second dose, 4 to 6 years old. Side effects and concerns. When you have chickenpox, you're very itchy, so whatever you touch, you want to scratch your skin, so whatever you touch is going into the infected area. So a bacterial infection on the skin, soft tissue, bones, joints, and bloodstream, that can be very serious. You can become dehydrated because you're fatigued, you're not feeling well, you're sick. You can get pneumonia, you can get inflammation of the brain. You can also get toxic shock syndrome with chickenpox. Those are the concerns that you can get with chickenpox. The side effects are blisters, ulcers, red spots, scabs. Like I said, you usually know when you have chickenpox. Your body's fatigued, you have a fever, you have a loss of appetite. That's kind of why you can get dehydrated, because you don't want to eat or drink anything. You can get chickenpox can cause headaches, itching, sore throat, and swollen lymph nodes. So it's very uncomfortable of a disease. It's probably more tolerable than more serious diseases, of course, but now I'm going to go over vaccine manufacturer and availability. Like I said, there's two vaccines available, the Varivax and the ProQuad. The manufacturers are Merck and Co.'s chickenpox vaccine. They've been approved by Food and Drug Administration, and the last dose product was last dose submitted was in January 1993. So we've been using the same medicine and vaccine for quite a while. The other information I wanted to add on chickenpox is it's usually mild, but it can become very serious, as I talked about the concerns and side effects that come with it. It needs to be treated right away. You don't need to let it get any worse. You don't need to, if it's a child, you don't need to have him go to school just thinking he has some red bumps pop up on him if he's showing all the signs and symptoms. The vaccine is your best defense against this disease. Of course, usually there's no known cases of getting this disease once being vaccinated. Also, you kind of trying to identify when someone has chickenpox, they're usually only scared to be around people who aren't vaccinated, and because they don't want you to catch the disease. So like I said, the best defense against the disease is a vaccination, the Varicella vaccine. Most patients have been diagnosed usually have a scar from the time in their life when they had the chickenpox on some form of their body, from itching or messing with it when they're not supposed to, because it can leave scars. Usually people older in age have a scar from chickenpox. That's pretty common in a generation higher than mine. It's caused by the Varicella zoster virus, of course. Varicella disease is chickenpox disease. And the Varicella vaccine is highly effective. Like I said, you can be around chickenpox and not obtain the virus when you have been vaccinated, and usually you aren't scared to be around someone when you have been vaccinated with the chickenpox. Unlike relating to COVID, you can see patients in the hospital who are still contracting COVID, even if they've been vaccinated, and also with the flu. You can still catch the flu if you've been vaccinated. The chickenpox differentiates in those aspects of everything. And thank you.